Hi, I'm Christine Hansson. I am a registered nurse. I work in the private sector at the Hobart Private. I'm on the Committee of Management and I am the Junior Vice President. I've been on the Committee of Management for more than 22 years, we think. We're not real sure. The role of the Committee of Management is like the governing body of the union to ensure that the money is looked after and spent appropriately, and we know exactly where all the dollars are going in and where all the dollars are going out. I started in 1980. Wow. I know, frightening. As my mother would have said, it's my nature. I'm a nurturer. I like to nurture people. I like to care for people, whether it's through mentoring people or looking after them as a patient, whatever. But it's embracing nurturing. Right from an early child, I was the one that was looking after the dead animals, trying to resus them and nurture. You know, if there was a sick lamb, I was always the one on the end of the bottle holding it. You know, and if something needed to be done, it was always me. I just loved it. Yeah, you know, delivering lambs when I was, you know, not even able to drive. You know. And that's getting onto it, that's one of the reasons why I love HACSU, is because HACSU has this nurturing of all people who work in the health and community services. It's not just nurses. It's everybody from cleaners right through to X-ray technicians, through to pharmacy, through to the orderlies, through to the kitchen, to the nurses. So it's not just nurses, it's a holistic way of embracing everybody in health. And that's, you know, as you can see, I'm a nurturer and I like to, you know, it's the big hug feel, so that's a part of it. Oh, I'm an operating theatre nurse. Yeah. So I've been doing that since 1985. But I love operating theatre, and that's changed astronomically. You know, they were big cuts down, you know, big cuts and lots of big instruments. Now we do lots of telescopic work. There's even computerised work that you can do, like knee replacements and hip replacements are done with robots as well. There's other robots that do major abdominal surgery telescopically. So it's really, really changed, and I've had a vast variety of everything I've done, right from, you know, plastic surgery right through to neurosurgery. Our workload has grown astronomically. When I first started in theatre, there used to be 4 of us in a theatre. Now there's only 3. There was no computers in theatre. And now it's, you know, a lot of our documentation is computerised. And in saying that, we still have to do a paper trail as well. So our documentation has increased as well. And the amount of cases that we do in private to what we used to do has grown, because every minute is worth a lot of money. So we have to push as many cases through as we can in the operating time, and so nothing ever gets cancelled, and we just continue going until we just drop. And that's whether you get a break or whether you don't get a break, well, so be it. But it is difficult, and it's really hard because we also have to teach and mentor while we're actually doing these cases as well. We're looking after completely unconscious patients the whole time they're up with us. We're maintaining their airway. You know, we're actually ensuring what's used for the patient is there at the end of the case, that we don't leave anything behind. So, you know, we're making sure that the patient's safe the whole way through. We're using electrical equipment with fluids, so there's a fire risk. There's a whole lot of things I could go on about, but, you know, we're there as the patient's advocate at all times. Yeah. I was very much pregnant in 1988 when all the nurses in Tasmania went out on strike for career structure. I was pregnant with my daughter. So that was massive. That was horrific. It was horrendous, but we actually achieved what we wanted to achieve at the end of it. So in 2021, I was involved in negotiations at HealthScope, and we actually, HACSU helped us, and we actually got protected action, and we actually took the nurses out on stop work meetings. And that's the first massive event that's ever happened to me since the career structure in 1988. So that was huge, massive, taking nurses out. in a private hospital, and we had doctors supporting us this time, which was excellent. First time round, the doctors never supported us. My husband and I have just started building a supposedly downsized house next door. We've subdivided some land from our house, and we've just started building our forever home.